Lynda, please kick us off.
Thank you so much. Thank you, Sherrina. Welcome everyone here in the room and online. Thank you for joining us here today, as Sherrina said, to our 10th annual Asthma Summit. I'm Lynda Mitchell. I'm CEO of Allergy and Asthma Network. I'm here today to thank you for your commitment to improving the lives and health of those living with asthma. So much has changed in the past 10 years, especially with respect to managing asthma. We'll hear more about that from Dr. Marshall when he joins us in a few minutes. The innovations in treatment have been life-changing and life-saving for so many, yet 10 people every day die from asthma in the US, and that really hasn't changed a whole lot. It's really sad. And so we all know that asthma deaths are preventable with proper treatment and care, and how can we change this? I think some of it has to do with the patient education, and so that's why we're here today. There's so much to learn and to share with people who live with asthma. We need to get the word out and to educate those with asthma on how they can manage this chronic condition and live a full life. As we all know, a lot of people with asthma they've lowered their baseline and expectations when that doesn't have to be the case. That's why we hold this summit annually. I hope you'll learn lots and get to network with many of the people in the room who are doing wonderful work throughout the country. Our host today is Sherrina Gibson. Sherrina is a consummate healthcare professional. We love Sherrina. She's also a supermom managing a young child with asthma and allergies. So what I'm going to do now is I'm going to hand it over to Sherrina after I give you a brief introduction. Sherrina Gibson is the founder and CEO of the Carter Foundation, a Virginia-based organization that empowers health nonprofits, government, philanthropy, and community-based organizations by showcasing their impact through data to amplify community voices to drive positive change. Sherrina has led research and evaluation initiatives throughout several different organizations, including a state Medicaid agency. These experiences have helped her to become a trusted resource for many healthcare stakeholders throughout the country. Her most important role is as food allergy inclusion advocate for her daughter, who was diagnosed with 33 different food allergies at 9 months of age and who also has asthma. She has served on various disability, equity, and inclusion-focused nonprofit boards and committees. She's currently the coordinator of the Richmond Food Allergy Support Group in Virginia. In this role, she works with providers, persons living with asthma, and their caregivers to provide support, education, and lead advocacy efforts. She's also an analytics strategy consultant. Sherrina is a true big data person here, and she works with us here at Allergy and Asthma Network. So I'm going to hand it over to Sherrina.
Thank you.
Good morning, everyone. It's going to be a long day if we're starting out here when we need to be here. This is a topic we're all very passionate about, and we're going to be here all day anyway. So can we do that over with a little bit more enthusiasm? Good morning. Good morning. Awesome, awesome. Good morning to everyone here in the room and for all of you joining us via live stream. As Lynda mentioned, this marks year 10 of our incredible work together as a community of clinicians, providers, advocates, researchers, community health workers, caregivers, and patients focused on asthma. Like Lynda and many of you, as she mentioned, I'm here in a dual capacity as someone with both lived and professional experience. I know what it's like to feel powerless and scared as a mother seeing my child struggle to breathe and being hospitalized after what was seemingly a simple cold. I've been fraught with unimaginable anxiety during her food allergy reactions, knowing how her asthma increases the risk of poor outcomes. As a health research, quality improvement, and evaluation expert, I've conducted countless community health needs assessments, surveys, focus groups, analysis of claims data, all of which continue to underscore that asthma remains a critical community health issue that needs to stay in the forefront of our efforts. Yet, amidst all these challenges, I also see so much progress and so much hope. I have witnessed personally remarkable physical and mental health improvements in my child once her asthma diagnosis and a treatment regimen were properly in place. I've worked with both small, federally qualified health centers and large primary care practices who have increased the usage of asthma action plans and patient adherence to treatment goals. And alongside the amazing team here at Allergy Asthma Network that works on the Trusted Messenger Asthma Coaching Program, I've analyzed outcome metrics demonstrating remarkable improvements in asthma control and quality of life for participants who've completed that program. By the way, if you're attending the college conference, make sure you check out the poster presentation on that program a little bit later this evening. So as Lynda mentioned, this year, like the 9 years before, our focus remains crystal clear. It's on the patient. That's why I'm especially excited about today's highlight, which is a patient testimonial. It's a powerful reminder of why we're all here and how our work impacts real lives. From the implementation of action plans to the groundbreaking advancements in biologics, we've made remarkable strides. But our mission doesn't stop there. We're redefining what asthma control means, ensuring that health equity and quality of life are at the forefront of our efforts. We must guarantee that every patient not only knows what their options are, but also has equitable access to gold standard care. We're committed to breaking down barriers rooted in social determinants of health and championing novel treatments and evidence-based practices. The network remains a trusted messenger in this vital mission. So turning to today. Today, we have an exciting lineup of presentation from esteemed experts in the field. Here's just a brief overview of what you can expect today. We're going to kick off the morning with a presentation to get us grounded in the most recent data on the current state of asthma, best practice guidelines, and the college's priorities. We'll then learn about the effects of climate change on asthma and other respiratory conditions, and we'll end the morning with an eye-opening take on the interplay between obesity and asthma in children and the novel treatments and strategies to address these comorbidities. During our working lunch, we will have two amazing speakers. The first is a representative from the Massachusetts Department of Public Health who will share their approach for implementing the Center for Disease Control's exhale strategies through a racial equity lens. Then we'll have the honor of hearing an inspiring patient testimony from a local resident living with asthma. Our afternoon sessions include myth-busting, social media, medical advice, and outdated treatments, the impact of racial and ethnic disparities in both maternal asthma care and race-neutral spirometry usage, and patient and caregiver perceptions of oral corticosteroids and biologic usage. There will be plenty of opportunities for dialogue, including Q&A after each presentation, and of course during the breaks and lunch. Live stream friends, we invite you to engage by submitting your questions and thoughts in the chat. We're going to wrap up the day with some reflections on what we've learned, but I want to give you this charge as we go through this day. I encourage you to listen to the presentations and participate in discussions with your colleagues. As you're listening and hearing this new and maybe information you've heard before, think about opportunities to elevate asthma care and to center equity. Remember that it's essential to think about the possibilities, not just the challenges. Think about what's needed not only from your own perspective, but the perspective of others, whether that be the individual patient with asthma who faces daily challenges, the healthcare professionals striving to provide the best care, the community member, community health worker, or caregiver who supports the individuals with asthma, and even policymakers working to shape legislation. I also encourage you to be a fully engaged and active listener. as this is an interactive learning session. If you haven't already done so, please get logged into Slido. I'll bring that up here, because there will be a poll included in each one of the presentations today. Engage with the folks at your table, especially those you haven't met before, or in the chat room if you're virtual. There's also a card on the table with a QR code for the Slido polls and also for the evaluation. So use these to collect your thoughts throughout the day, your questions, your suggestions for improvement, because your input is valuable. And once you complete that evaluation, you get a prize. I won't tell you what that is. No, it's the coveted Allergy Asthma Network inhaler poster, which most folks find as a really, really helpful resource. So that's our roadmap for today. I hope you're as excited as I am to begin this journey. Before we take off, can we just do one quick slide here? Keep going. Okay, I think she wanted me to put this up real quick so you could see this. There we go. Here's the first poll question we want to start off with. Who is joining us today? Who are you? And of course, multiple perspectives apply. So please click on this poll. That includes all of you online. And please let us know who we have in the room, who we have online. Just give a minute there and then we'll move on. Okay. Do we have Bethany who can tell us the results? All right, well, we're working on that. We're just going to keep going because we don't want to delay with getting to our first speaker.